Hi, I am Dr. Manjunath, consultant pulmonologist at Medicover Hospital, Whitefield, Bengaluru. Today, I want to discuss something about post-infectious cough. Of late, we are seeing lot many patients with prolonged cough or lingering on cough after a bout of respiratory infection. And whenever your cough is prolonged for more than 2 weeks, please get in touch with your healthcare professional. We may require to do some basic investigations like chest x-ray to rule out any other serious cause, and we may need to treat you with maybe inhalers, anti-allergy tablets, or even cough suppressant syrups or lozenges. Very rarely, when the cough is too disturbing, can require systemic steroids as a treatment. So this is usually caused by prolonged inflammation in the windpipes or sometimes even postnasal drip. Even if you see a tinge of blood with your sputum, please don't get panicked. It's very common thing to occur. So post-infectious cough can prolong up to even 12 weeks or even months together. So don't get into panic mode. Get in touch with your pulmonologist.